Hello, guys, and welcome to, the second chat we're doing here with DMD Pathfinders on our coronavirus updates video series that we've started doing. It's a crazy situation at the moment, isn't it? And me and John were back, and we're joined today by Benjamin James. I don't know, Benjamin, do you want to introduce yourself?
Yeah, sure. So I'm Benjamin. I'm a trustee for DMD Pathfinders. And like most people, trying to just navigate this crazy situation we seem to be in, and try and keep cool.
Yeah, it's great to have you here, Benjamin. Thank you for joining us. And so today it's all about shielding now, isn't it? So kind of feel like we should have some props, some actual shields or something.
Yeah.
Maybe some kind of we're all living in a bubble now.
Yeah, how's that going for you guys? And yeah, well, I mean, what are the logistics of it, and what are the effects of it, I guess?
It's just kind of basically staying at home, and yeah, trying to manage that in different kind of situations that we're all in. Like, how do you actually interpret that into real life can be a bit of a challenge. I think, you do sometimes get the feeling that people that draw up these criteria aren't actually kind of often aware of the complexities and actually how that would work in real life. So for me, one of the big challenges is obviously I've got personal assistants coming in and out, and just kind of trying to stay safe with lots of people coming in and out. And there's people have had a lot of issues with getting like protective equipment like masks and gloves and that kind of thing for their care assistants. So it's actually kind of really quite a challenge to actually shield yourself, and the idea that you can be like kind of safely tucked away at home when actually you're dependent on people for everything that you do it's difficult to actually apply that. Benjamin, how's it been for you?
Yeah, and it's been similar to me. It's this guidance on shielding and social distancing, but actually as somebody who needs support, that can be incredibly difficult to try and abide by those rules whilst you've got different people coming in, and whilst they are doing their best, and I know people come in there, make sure they wash their hands, and that's only the fact that you have to have people who are outside of your household support you. It's just increases a risk, doesn't it? And it can be hard, and I feel like the logistics of that hasn't been thought about. And I know it's a situation that has developed, quite rapidly, but people who are supporting those with different needs, I feel like they haven't really thought that, some disabled people need support, and how do you manage shielding within that to reduce risk of getting it?
Yeah. Just to remind everyone, we're 2 weeks into more or less a lockdown, kind of a light lockdown in the UK here, and a couple of months really into the coronavirus pandemic. And yeah, I mean, this shielding thing of, people who are considered in the vulnerable category, not going out or not having people who are gonna people around them who are gonna potentially let them catch the virus. I think it is really tricky, isn't it, with the whole idea of where the happy medium is, or where, if there is a medium, or if there can be a medium, how do you find balance within that? I guess if you lock yourself in a room, well, how do you have care? How do you access your carers? I mean, as I was just saying before, my situation with my brother Andrew, I'm currently his main personal carer, and in all this, I'm kind of seen as an outside force that could bring in the virus into the house. So I think it is really tricky, and I think lack of planning around this, or a lack of logistical planning, what happens when something goes wrong, leaves a lot of people not just in situations where they don't know what to do, but situations where they're then extra vulnerable, kind of mentally, isn't it? Or logistically, just because you then feel like you might always, some people might feel like they have to then go to the extremes of sort of cutting everything. Where have you guys found that, that is there any balance for you?
Well, I think it's hard for me, and something that I don't think again has been thought about is if you're in a household with a key worker. So my mum is a key worker and is actually going into hospital. While she's not in a high risk area, she's not involved in the main hospital. She takes bookings for pregnant women and does that sort of thing. She's still having to go into that environment where, yeah, there is a potential risk. And that's been quite challenging for her. She's been so conflicted, and she has brought it up with managers to say, look, I can work from home. These are the things I could do. And I feel like people haven't got that. And often what can happen is people compare to other people who are in different situations, who have different conditions. But obviously that isn't helpful, because it doesn't matter, because the fact is having shared puts you at an increased risk. Having a muscle disease puts you at increased risk. And it's trying to manage that. And again, I think that's something that hasn't been thought about, and it's definitely affected us. And Mum's been quite nervous about going in. And so last week she had to get the bus because my car was being repaired, and that really made her feel quite, anxious. But now we've got that back, she's a bit calmer, and hopefully they'll let her do some work at home. But that can be hard when someone's going out to a place where there's increased risk and could be, like you say, bringing it back. And we're trying to, do the right things. She makes sure she comes back and has a shower as soon as she gets in, washes her clothes at high temperature, and does all those things, and make sure we're cleaning the handles and doing all the things you should do. But again, you don't know that, it's that makes it quite a challenge.
Yeah, and for me, my thankfully my husband is now working from home, so that means he's actually kind of shielding with me. Because the actual advice on shielding, is to, if you're living with people, to actually minimize the amount of time that you spend in shared spaces with other people that aren't shielding. And the idea of kind of trying to avoid my husband for the next God knows how long, really until it's deemed that we're safe, is not a kind of prospect that I could really happily live with. So I'm glad that he's actually able to shield with me. But then I'm also thinking, at some point, is that going to change? When the risk is like lowered slightly, but it's still a high risk. Is he going to end up going back to work? And I'm kind of trying to manage that. And yeah, I think it's really is a tough call for everybody to make in terms of like how exactly they interpret the guidance into their own lives, and kind of how they manage the real life situation. And I think it is kind of down to people to decide how to manage the risk and what risk they're willing to accept. But the stakes are higher than they've ever been, and we just don't know what would happen if we got the coronavirus. So I think we're all erring on the side of caution, really, and kind of like doing things as stringently as possible. But there does have to be a balance in terms of you do actually have to still be able to live some kind of a life.
Yeah, so I mean, are you still getting your carers in as normal? Have you maybe cut some of your carers? What kind of precautions have you had to take?
I've tried to reduce the time I have them, because I can do a lot for myself. So fortunately for me, I don't need so much, say, that John might need. And then I've tried to just rely on Mum. So trying to interact with one person, not multiple people. But fortunately, I can do that. But obviously, I appreciate not everyone can do that.
So yeah, I'm just being as careful as I really can be, to be honest, in terms of getting everyone to use masks and gloves and that kind of thing. And essentially, kind of, I'm treating everyone as if they have the coronavirus and just behaving accordingly. I mean, it's not a nice thing to kind of feel when you've got people coming in and they're almost like a threat, and rather than someone who's helping you with your life. But it kind of I think that's just something that we've got to adapt to, and I think everyone, at least all of my carers, understand the stakes involved. So I think they're all happy. They're all happy to be very careful and to kind of I guess be a little bit forgiving if I'm kind of like, I don't know, on their case about hygiene. So yeah, I mean, I'm doing everything I can. I've had a lot of PAs kind of already getting sick or going into isolation, and it is a worry that there probably has been a period of time when I may have been exposed. But I don't really see another way to kind of get around it. I mean, I have I have been quite stringent in the isolation criteria, and sometimes maybe just being extra careful. Sometimes going further than the guidance suggests. But yeah, I just kind of that's what reassures me really. So yeah, I have at the moment got a kind of reduced care team, really by default, but I think that's probably kind of good in a way to, as you say, just reduce the number of people that could be potentially bringing in the virus.
Yeah, I think it's so tricky, isn't it? Because there are so many sort of incongruencies. Like you see younger people with Duchenne, their families kind of putting up posts on Facebook. Okay, that's it. We're in lockdown now. No one's leaving the house for 12 weeks. And in many ways, that's almost like a privilege to be able to do that, isn't it? When you see kind of older people with Duchenne, can't just have that entire lockdown on the house. But the irony is that the virus would theoretically potentially be a lot more potent, or a lot more harmful. So I think that's I don't know. Certainly from my perspective, that's where balance has been hard, looking to try and see, well, okay, how much should I still be doing, or how much can I still be doing, given that I'm sort of an outside influence, I could be contagious. And yeah, it's I don't know. I think it looks like you guys have certainly managed to find some kind of balance that you're certainly mentally and emotionally happy with, though.
Yeah, I mean, I wouldn't want to suggest that I'm entirely happy with the situation. I think, as with everyone, I am feeling the stress and the anxiety. Every kind of health blip, you're kind of like wondering what's going on, and like you're getting worried, and just trying to keep positive momentum up can be quite challenging, I think. But yeah, I found different ways to try and do that. But I think like I haven't reached the point at which I'm kind of happy with the situation. I think like it's on and off every day. There's worry and kind of and stress, and I think it's a constant battle for all of us to kind of to not let that rule our lives.
Yeah. That's really interesting about you, Benjamin, saying about how your mum's sort of a key worker in the NHS. I think that's such a an untalked about example, really, as well. People talk about, well, what do key workers do for their family, but then they don't really talk about, well, what do key workers do when their family is in a situation where it might be extra harmful getting the virus. So keep us updated on how that goes, because again, that sort of touches on something that I reflected on, which is this idea of people working from home is something that's we're sort of very quickly finding out is something that's always been possible. And it's just, you know, that people didn't really want to. And that's one thing, that's a culture thing. But when it comes down to it, it's really interesting and fascinating to see people still being resistant to that when it's almost a life and death situation. You know, how far do you get to still trying to keep the cultural and social norms? And I am fascinated to see how things go back to usual, or if things do, when, you know, if, you know, when things eventually change or go back to the way they were. So yeah, I don't know. We were gonna always want to kind of finish on a positive note. Benjamin, what have you been doing to stay positive in the midst of all this madness?
I think I've been trying to get that balance. I have been allowing myself to go out just around the block, and actually people have been very, very good at across to the other side of the road. And I kind of joke with Mum, I'm like, oh, who's my next victim? Who's going to cross? And they've all done it. But it's been weird because you approach people and you're like, are they going to move? You start to get a bit anxious, but that's been quite positive. And also just trying to.
If I just say, I had that in the supermarket the other day.
Yeah.
I was pushing my trolley and I loved that everyone was just getting out of my way. And then someone didn't. And I was like, am I meant to get out of that person's way? Can't they just keep getting out of my way?
Yeah, you're in that tricky sort of thing that you wouldn't even think about normally, but obviously sort of have to now. But also other things is just trying to set yourself small projects. I mean, fortunately, I've got a couple of work projects I can get on with in my day, but also it's trying to remember and treat things like work. So have a sort of 9-to-5 attitude, because the risk is if you're at home, you can let work and rest will start to slide into each other, particularly if the only space you can work is on a desk in your room. You know, you don't have a separate space, like I don't. But just setting small projects, even like, oh, I want to sort out this box, or I need help to sort out this, or do that, I want to read this book, or whatever it is. Just setting yourself sort of small goals and making sure you do things that you enjoy, or watch a film or whatever it is to relax. And don't forget to do that. And perhaps don't always watch the news. Maybe put a limit on it. Maybe say, I will only watch the evening news or the morning, you know, or whatever it is. Try and not look at it like 24 hours, because you will go crazy. I feel.
Yeah, I find much the same. I think that's really good advice, actually. And yeah, trying to limit my news content, definitely. Yeah, I've been used to working from home for quite a while, but I think it's a whole new kettle of fish when you've got all these other things to worry about as well. But yeah, it is going back again to the basics of working from home and how to make that, you know, and even if you're not working, just how to kind of like structure your day. I think having a schedule or maybe one or two things that you want to get done, I think is a useful thing to just to really help structure you and kind of keep you sane as much as possible. We've still been, you know, doing things like baking and that kind of stuff to kind of occupy our time, and yeah, just trying to think creatively about how to keep entertained and amused. And I think that's really important.
Yeah, and well, with me, obviously, as I say, it's been tricky for me and Andy at the moment, but it was his birthday the other day, and we did have a bit of a fun video that we put out on Facebook, although that is the furthest he's been outside the house for a while. He's lucky he's got our back garden, so he can still get some fresh air. Obviously, that comes down to balance again, though, and seeing how the situation is and how it all progresses. But yeah, I think it's always good that in the midst of whatever madness there is, we can always find ways to remain positive.
Yeah, definitely. Yeah, I think it's worth people knowing that, you know, we're all going through this together. We are here. anyone wants to get in touch or has any kind of questions or I don't know, wants to share how they're like keeping sane during these times, I think it's really good to hear from people and to have that kind of community involvement.
Yeah, absolutely. Yeah, get in touch. And yeah, like we say, we'll be probably doing another one of these in the next week or so. And yeah, just seeing how the situation develops. Well, thanks, guys. And thanks, Benjamin, for coming on. It's been great. And yeah, we'll see you all again soon.
Yeah, stay safe, everyone.
Yep, stay safe.
Bye-bye.